Sinusitis is a real problem in primary care. We've just published a great study, a randomized controlled trial by Paul Little and his group in Southampton. I had a chance to catch up with Paul at the SAPC conference in Dublin. This is what he said.
So really the reason we did this is because chronic and recurrent sinusitis is a major issue for patients, really poor quality of life for these patients, similar to having a serious chronic disease. And we knew that there'd been a couple of smallish studies on nasal irrigation, that's saline nasal irrigation for people with these recurrent sinus symptoms that looked like it worked pretty well, but they hadn't been done in sort of typical primary care settings. And also it involved relatively intensive coaching. So we wanted to see whether something simple and practical that a GP could do very easily would work. So what we did was we gave people these neti pots for nasal irrigations, instructions how to make up the solution, and asked them to irrigate on a daily basis. And we found a mixture of things, but moderately positive results. What we found was getting on for 10% of people had significant improvement compared to not doing nasal irrigation over about 3 to 6 months. So really something that's better than nothing. Clearly, it's not as good as the previous studies. But the other nice thing, as well as a little bit of benefit for symptoms, as I say, people were using less over-the-counter medicine, fewer headaches, and didn't feel that they would need to see the doctor as much the next time. So if you like, we were demedicalising the illness and helping empower them in the management of their symptoms. So it would have been nice if we had a bigger effect. We're not quite sure why we had a smaller effect in the previous trials, because people did seem to be doing it, but it may be that extra bit of coaching helps. So probably the next question is, do we need to help people with coaching? And also, it'd be nice to know whether this helps with acute sinusitis, for which nearly everybody now still gets antibiotics. So there's still things to do, but it's really nice to be able to offer people with this really difficult problem something they can do which will help.